you. Hope everybody.
Hi, my name is Daniel Stacy. I'm the Executive Director for the Illinois Mental Health Counselors Association. We're pleased that you can join us today. We have a wonderful webinar presentation, The Emergence of Telehealth and Teletherapy, exploring technology, compliance, payment, and practical solutions. We have three great presenters with us, Scott Allen, Miguel Cerda, and Raymond Barrett. We'll start off with Scott Allen. Scott has a great presentation for us, and is the president and co-founder of 2MI Software Solutions. 2MI Software has a suite of cloud-based video communications software applications, including their HIPAA-compliant VP Therapy 360 package, which is designed specifically for mental health care professionals. Scott has held national and multinational management and sales positions with Sony Professional Solutions, Sony Electronics, Capatronic Displays, and Western Digital Corporation. He brings expertise in high-definition broadcast production and video solutions, and most recently, 3D virtual reality software and services. Scott, take it away.
Thank you very much, Dan. I appreciate this opportunity and hope we can pass along some useful information today. A little bit more on my background, because I am in the high-definition video communication software business. I've actually been in video my entire career, starting with Western Digital Paradise Graphics back in 1987, where I was involved with the original VGA chipsets, and then moved into the display business, and subsequently went on to manage the IBM business for Sony Electronics for their professional series displays, and then with Sony went into the broadcast production, where we had what we call professional solutions, and under that was Sony Sports. And so I was able to work on a lot of sports stadium upgrades to the HD world. So I have a very low tolerance for poor video, for any type of latency, which I believe is the key to either having a successful therapy application or telehealth application, or an unsuccessful teletherapy application. So we are very focused and centered on high quality video at all times for therapy. So moving on to the headlines of the day, I know that this is a big, it's kind of a big, bold world out there, kind of the future, teletherapy, telehealth, telemedicine, all those things. But the idea that we're trying to reach more people that require help than we actually have the professionals to do so. So by changing and allowing different modalities to come into play, we're able to reach more people with the same number of clinicians that are out there across the board. So some of the confusion that is out there, and I want to try and kind of give you my spin on it, is there's telehealth, there's telemedicine, there's teletherapy, there's telepsychiatry. And the way I kind of separate them out is, telehealth is sort of an MD-based, checkups and follow-up appointments and follow-up operational procedures, whereas telemedicine actually has some devices that are hooked into remote locations where a doctor can be on one side, and that's that center picture where there is actually an ability to have a camera to look into people's ears and do general checkups from a remote location. And then obviously teletherapy encompasses any type of mental health procedure, whether it's telepsychiatry, where psychiatrists are prescribing medicine to remote facilities where patients come in, or in just general therapy sessions with counselors and LPCs and the like. So it's all kind of the same, because what it is it's being able to communicate face-to-face in real time with good audio, good video quality, so it's mimicking as much as possible you being in a room with that patient, no matter what you're trying to accomplish. So this slide kind of shows a little bit of where we've been and a little bit maybe where we're going or where we are. Telehealth has been around since 1962. It was kind of developed in the NASA program, or by NASA for the space program, as a way to monitor the astronauts in space, and it's evolved quite a bit. And over the years, technology has come into play, and broadband and less expensive hardware is making it more and more viable and available to everyone today. But on the left, you've got that old telepresence, which was a Cisco product, which they worked with Sony on some of the display technology and the camera technology. But that was an extremely expensive setup, probably $250,000 per side. And then below that is one of the original Polycom sort of big giant carts that you could wheel around a hospital and remotely connect with doctor to doctor, doctor to patient. The one in the center is more like the current Polycom systems, where again, cart-based, where they're in hospitals and facilities. And now with new technologies and new services, and I'll say Teledoc is one of the ones on the MD side, where you can actually just, if you have an ailment and you don't want to go to the doctor's office, you can just dial a doctor and swipe your credit card, and they'll tell you what's wrong with you or if you need attention further than that call. And tablets come into play, notebooks, desktop PCs, with your standard broadband that's offered in a lot of homes and certainly businesses. Kind of have that little circle around the telephone only because of the feedback we've gotten on the mental health side of things. I'm not going to say that you can't have a follow-up call with a doctor and say, I'm feeling much better, I appreciate it. There's that kind of face-to-face. But for therapy and mental health therapy, I think it's important to have the real estate of at least a 10-inch tablet so that you can really pick up on the nonverbal cues. And this is coming as a non-clinician, but it is coming from the standpoint of having a lot of customer feedback and agreement with that. So worst case, I think telephones are viable, but we prefer having a little bit more real estate. Back in the early 2000s, like I said, it was sort of a kind of a wild west with teletherapy and telehealth, and there were a lot of privacy concerns that came up. So obviously, the Health Insurance Portability and Accountability Act from 1996 came along, and that was really more about how we manage records and keep our PHI protected and secure. When teletherapy started to be used and people were using different devices to talk and communicate, and Skype came along and FaceTime, there were still a lot of security issues with that, and I think that's what brought about the HITECH, which is the Health Information Technology for Economic and Clinical Health back in 2009, and it really kind of, as it says, gave HIPAA some teeth. It provided with penalties for violations, and this is where the business associates agree came into play, so that if there was a breach of information, it wasn't just the clinician's fault or the patient's fault. It actually had to go through the technology provider. So it just basically made it so that everyone involved in the overall communication part of teletherapy was held somewhat liable. So any type of video communication software solution that you get, you must have a BAA. And I talk a little bit about that in a little bit. But the HITECH is really what brought about the whole BAA. And then obviously the meaningful use is a little bit further definition of how you use it and things like that. So again, going back to the to the importance of HIPAA and HITECH compliancy, Skype and FaceTime and Hangouts are all out there and very popular, but they're not HIPAA compliant. And I'll also say this: I think a lot of clinicians we've spoken with have had, it's kind of set video therapy back quite a bit, because you can't have efficient and effective therapy when you have poor quality video. And sometimes you get on a Skype call, and sometimes you get on a FaceTime call, and it's great. And other times you get screen lock and face lock, and the audio and video, your mouth doesn't line up, and it's just not effective. You just have no way of effectively reading your client, and it's just really kind of leaves a bad taste in everybody's mouth. And that's why it's important to kind of go with some of the newer type of applications that are out there. Again, the ability to have broadband and hotspots via cellular networks is really kind of, everything is converging to the point where I think software, hardware, applications like ours and others are out there that you can actually go and really make this a viable service to your clients and to your practice so that you can mitigate cancellations and have therapy sessions that are short and not waste people's time if it's not necessary to come in to the office. Now I'm going to say this, I personally believe that teletherapy is really meant to be, for the most part, a supplement to face-to-face. You know, it's going to see, we'll see how this evolves, and I think there are going to be some types of services, and Ray may touch on services out there right now that may or may not be ethical. But for our purposes, I actually come out right up the beginning and say, we're not trying to replace face-to-face therapy. We're trying to give you an alternative way to talk and treat your clients when face-to-face is not available, nor if it's not needed, if it's a follow-up or something like that. But video communication platform requirements. This is really kind of what's important to you as clinicians and people with practices that want to get into teletherapy. You must have a VAA. If you don't have a VAA or service provider that you're looking at won't provide that, you will not be HIPAA compliant, you won't be HIPAA secure. You need to have secure and encrypted technology. It's the database or whatever type of PHI is on your video system. If you have to download applications onto your devices to work the communication, you have to make sure that that is all encrypted. And each of the sites should be under an SSL, which is a secure socket layer protection. Obviously, we want it to be easy to use for you and your patients. And obviously, not everyone's super technical, so if you can make it so that you can click a button and fill in a name and a username and a password, it's easy. You know, feature rich is really is dependent upon how deep you want to get this into your practice and how much you want this to be a standalone system. And of course, I believe the high quality, consistent video is the key. You need to be able to deliver solid, you know, service and be able to read your patient as best you can every single time you get on that call with them. The last thing is compatibility. Everything is moving to the cloud. Our solution is cloud-based, so we don't have as many compatibility issues as you do when you have what's called client-based software, where you actually have to download software onto your computer or your device, and then your patient or your colleague, whoever you're talking with, has to do the same, because then you run into problems with operating systems and, you know, is it an Apple iOS, or are you using Internet Explorer, are you using Windows Professional, Windows 8, Windows 10? So if all you have to do is click on a URL through a browser, whether it be Chrome or Firefox, your points of failure and your success rate and your frustration is going to be much lower. So those are really the key features to selecting a service. So what's coming down the road? I think Dan mentioned it in a past role. I was involved with some virtual reality right when the Oculus deal was done with Facebook, and had a lot of opportunity to see a lot of virtual environments and some augmented reality with these giant virtual caves and such. But I do believe at some point in time, you know, you're going to be able to use some types of virtual reality for face-to-face, you know, just to make it even more realistic from a face-to-face standpoint. And then on the right, this augmented reality, this is actually a picture from a therapy session that was done in London, and it was, you know, for people with fears. And as you can see, the patient has this headset on, and they're basically looking, or they think they're looking at a spider that's right in front of them, and then the doctor, the clinician, actually has a fake spider and is touching it. So it's there's a lot of interesting applications that are coming out, and I think over the next few years, as people get more and more used to the VR type of experience, whether through entertainment, it's going to make its way somehow into therapy and mental health. So we will see what the future brings. But that is all I have for now, and I'm going to pass it back to Dan, and we'll go on to the next one. So thank you very much, everyone.
Well, thank you. It was very helpful. I think you provided us with a lot of good things to think about and a lot of great information. Our next presenter is Miguel Cerda. Miguel is the co-owner and executive director at Lifestyle Consulting Services and Fernandez Community Centers with 4 offices employing 25 clinicians. He has successfully introduced teletherapy into his practice and is very familiar with the advantages of adding this service as well as the challenges. He has experience and can talk extensively about working with the managed care organizations to amend contracts, working with insurers regarding teletherapy coverage, and working with patients to ensure they are familiar with the informed consent of virtual therapy sessions. Miguel has extensive business management and entrepreneurial experience, having built a successful chain of dry cleaners in the New York area. I think Miguel's going to have some great information for you practicing counselors out there. So turn that over to Miguel.
Yes, thank you, Dan. Good afternoon. I want to start by speaking about basically on the provider side. What does it take to get paid, number one? How does it work? And basically, I'm going to tell you a little story about my wife and I. My wife, like Dan said, has 4 offices in Raleigh, and started working with her, I would say, beginning of last year. And the first thing I realized in her business was all the cancellations. There was 10 clinicians, and they were averaging, I would say, 3 a week. So I said 3 cancellations, 10 clinicians, that's 30. 30 hours a week times 4, that's 120 a month. Let's say on the average, you're not going to pay that, but let's say $100. Now, how much money was my wife losing? I just couldn't believe the number. So I started, I would say, right away looking into what could be done. And part of the solution was the upcoming teletherapy. I did a lot of research. I ran into about, I would say, 4, and they just didn't convince me. And the quality, and my wife does a lot with kids, and I just didn't want the experience to not be a great one. So I would say mid last year, I met Scott Allen and his team, and I was so impressed with the quality. And I said to myself, you know, this is exactly what I'm looking for. And I joined the team because I think that I was able to bring an insight as to what could be done to better, and also to give just an outlook of the business side in terms of talking about what happens to my wife on a daily basis and what we go through. And since then, I joined the team, and my wife really loves the just how the kids find it fun now, because they're able to use a MacBook, they're able to use a Chromebook, they're able to use an iPad, and they will go to her office and, oh my God, another doctor session, and just be a little scared in the beginning, but they find this fun. So for my wife, who deals with kids, she really has seen that the kids interact better using this. Now, I'm going to talk to you about the states that are presently using, they're paying for these services. You have 32 states, including DC, that have some kind of private pay policy. As of January 1st, most of these private payers are going to start paying. And as you can see in circle there, we have Illinois. The rate that's being paid is exactly the rate that you will get paid as it would be face-to-face. Now, how do I know? I recently, 2 weeks ago, called Blue Cross Blue Shield to verify for a client. And Blue Cross Blue Shield verified that that client had $5,700 for the year, and that we will get paid 100% of what we will get paid if it were face-to-face. There are other private payers that Scott Allen told me that a client of his verified, which is Cigna and Magellan, that they also called for a client and confirmed that they are going to get paid 100% as it would be face-to-face. This is great news for this industry, and I can see that as we move on, we're definitely going to get Aetna, United Healthcare to participate, and I'm just really, really happy to be part of this group that's looking towards the future. I'm going to present to you the codes that we basically use on a daily basis in order to get paid. Here we have the 90832, which are 30-minute sessions. In our practice, we mainly use the 60-minute, which is 90837. And also I wanted to bring up that our psychiatrists, I'll give you an example. Today at 5 o'clock, I'm headed to a home. My wife this Saturday saw for the first time 4 kids, and they didn't have transportation. So today at 5 p.m. I'm going to take our MacBook, I'm going to their home, and the doctor's going to be able to see them today. And this is, maybe I could call it Uber therapy, but obviously maybe we won't be happy with that. But it's just ways of how teletherapy could help not only our practice, but could help reach kids, audience, and maybe parents that don't have a car, can make it because the kid, was sick, they have to work. So it's just another avenue of how we could help everyone that's going to benefit from this. And my next slide, here's the information where you can register. This is a pre-recorded webinar that you can register just to get more information about how to get paid in teletherapy. I want to thank Dan again for the opportunity, and I'm going to pass it over to Ray. Have a nice day.
Miguel, thank you very much. That was very helpful. It's good to hear someone that's actually in the field and the practical end of doing it on a day-to-day basis. From there, we're going to turn it over to our last presenter, Raymond Barrett, LPC, LMHC, DCC. Ray is the founder of the Telehealth Certification Institute, LLC. Telementalhealthtraining.com. Telementalhealthtraining.com. He is an expert practitioner and educator of telemental health services. Ray has extensively provided telemental health counseling services in private practice, for facilities, and for an EAP program. He shares his expertise through his top-rated courses and by providing consultation. Ray asks the tough questions and discovers the solutions. Trainees find Ray to be very approachable, available, and knowledgeable. Most recently, Ray was the presenter on telemental health at the American Mental Health Counselors Association annual 2016 convention and presented a full credentialing course at the LPCA North Carolina Chapter's annual 2016 convention. So Ray, we're going to turn that over to you and look for some more helpful information. Ray, I can't hear you.
All right, thank you, Dan. I appreciate that.
All right.
And sorry about being muted.
Okay.
Yeah, and I met the other presenters, Scott and Miguel, in North Carolina at the Counseling Association's annual conference this past year, where I presented the full credentialing course. It was a 2.5-day course. We had a good time. And let me share with you some more information on telehealth. Let me see here. Sorry that I was on the wrong slide. All right. So how telemental health is actually being utilized? Let me share with you how I myself am utilizing it and have utilized it. My very first client that I had was over the phone. This client's wife actually found me online and thought I'd be a good fit for her husband. So he called me, but he was from, you know, a pretty significant distance. And I didn't know how to register a client, how to verify their identity, how to take payment, all that kind of stuff from a distance. I didn't learn any of that stuff in my master's program. So I looked for you know, answers to all my questions, and I got more and more interested. And from then on, from that first client, I've been providing telemental health therapy. I also worked for an EAP program providing telemental health. And this was important because I was working for a chain of gas stations. And usually those that work at gas stations are young people, and crazy things happen at night at gas stations, really traumatic stuff. And these young workers are not going to go seek out counseling after such an event. So what we would do is we would call them, because that's how they're available. So we would just call them, do a check-in, debriefing, triage, and offer follow-up services if they would like, which often was phone counseling, which worked out really well for them. It really overcame that barrier for them receiving services. I also provided assessments, telemental health assessments, for a large hospital system. And I did that from another state. So I did that from New York, and this hospital was in Georgia. I did that for over 3 years. So telemental health has really overcome a lot of barriers for my clients and those that I worked with. Other examples from my own experience in private practice are such. I had a client who I was seeing, a high school student. He got a job after school, so he was no longer able to make it during you know, my hours of operation. So therefore, having telemental health sessions solved that, because he was able to have a session in between school and work where he normally wouldn't have been able to because of the time of transportation. I've had many other clients who had scheduling issues. They were just busy, just couldn't make the drive, and we would have sessions through telemental health. I worked with families where one particular example is working with a child, and we wanted to have a consultation with this child's parent who actually lived in another state. No, actually this parent lived in the same state but at a distance. So we, about 3 hours away. So we had the consultation through telemental health, which was very important for this client. I've had several couples contact me for counseling because of the convenience of telemental health. So there's many ways that this comes into play, and I'm going to share some other personal examples, and I call them personal because they really touched my heart. When I moved up to New York State, I wanted to see who else is doing telehealth around here, right? Who's my buddies to talk to about this? And just 20 minutes from my house at the Finger Lakes Community Health Program, they actually are forerunners with telehealth. They got a $2 million grant to buy a bunch of nice equipment for telehealth. This was about 6 years ago. And they've definitely put it to use. They've made big differences in our community. And let me give you some examples. Those with diabetes have to get their eyes checked. Only 5% of those coming to their clinic were getting their eyes checked who had diabetes because they didn't want to have to go to the city to do it. So it was a simple solution. They bought a retinal scan machine, brought it in. Immediately it went from 5% to 100%. Everyone that walked in with diabetes got their eyes checked. Teledentistry, only 15% of those with dental care needs got what they needed, got dental care. And they needed serious surgery. This is what really touched my heart, how many, they have real significant teeth issues. So with teledentistry, that's up to over 90% now. Not just because they're getting teledentistry, because with the teledentistry, they do the assessment through teledentistry, and then they make the appointment, and then they still have to go to the city for the procedure, for the surgery. But what we found out is having a warm handoff using technology, using telehealth, really increases the follow-through rate. So that was very helpful. Psychiatry for children and adolescents. They didn't have one, right? But with telehealth, they were able to get a psychiatrist, then people were able to be seen. So I have many, many, many examples of how telehealth is overcoming barriers, and that's what's important. Let's get people help. And people do have barriers to access for multiple reasons, and telehealth is helping to overcome those in many ways. Another aspect of telehealth that's very helpful is clinical supervision. One important thing with clinical supervision is fit. One thing I think people ought to think about when it comes to telesupervision is the parallel process between supervision and counseling itself, right? With telesupervision, you still have the verification of identity, the assessment for fit, the consent forms that have those specific items needed since it's done from a distance, securing of technology. All of these things, the clinical skills, the emergency management plans, setting of boundaries, all these competencies and skills that go along with telemental health is relevant for telesupervision. So in terms of fit, right, sometimes it's hard to find a clinical supervisor in your area that's actually a fit for you, that specializes in the niche in which you want to practice. So being able to connect with a supervisor remotely really opens up doors in regards to that. You could do supervision with a group, individual. Another thing about supervision is when I was going through my master's program, I'll never forget the instructor said, everyone ought to think about going to Catholic charities for supervision. Catholic charities, and the reason why was because at the time they were the only ones doing direct observation. They used a one-way mirror or two-way mirror, whatever you call that, right? So they were the only ones doing that. So that's why I actually got supervision from the Catholic charities and did volunteer work with them. But with telehealth, it makes direct observation for clinical supervision very easy. Now, if you're ever going to do any of these things, telemental health, telesupervision, you really ought to be trained and competent in doing so, because you have to take great consideration into how do you create, store, transmit, and destroy the recordings. You ought to have adequate consent forms. You ought to have policies and procedures and do a risk analysis, all these kind of things, which is important no matter how you provide services. So that's another really great utilization of technology. Another one is communicating with colleagues. I find that a lot of people drop the ball with confidentiality, with securing confidentiality when it comes to communicating with colleagues. Often people, you know, they have filing cabinets with locks locked behind a door. They keep their hard drives, you know, secure on their person and so forth. But then when it comes to communicating with colleagues, they send text messages. Oh, I saw this patient in room 234, or can you follow up with this patient, or hey, I have this referral for you. This is their name and number through text or email, or an insurance company sending you information about a patient, or an EAP program sending you a PDF or whatever with client information, or your biller sending you information through email and text. It's really crazy. So it's really important to utilize all of the great technology that we have to really back up what we say when we tell our clients everything is confidential. You know, our colleagues are usually at remote sites, right? We don't all sit in one big room in cubicles. But coordinating care is super important. And we could do that very effectively. We could actually greatly increase coordination of care by using the right technology. That's one of the big pushes with the Affordable Care Act and meaningful use, and government's given incentives for it. So technology certainly helps overcome those challenges. Another one is working with treatment facilities, and not just substance abuse treatment facilities, but any facilities, any organizations that you collaborate care with. Looking at recovery facilities, often there's an assessment for eligibility. And how do you do that assessment for eligibility? Do you travel out to each prospective patient's household or where they are, right? That creates a lot of challenges, and a lot of people are doing that. I tell you, I think the greatest turnover, and this is just a guess, right, from what I hear from people, and by the way, turnover's one of the highest expenses for any company, right? The hiring and firing, and not even if you're firing, but just the rehiring process is very expensive, and all the training that's involved with it. And telehealth actually reduces turnover, it increases retention. People love it, makes life easier, okay? But is a lot of these organizations that send clinicians to homes, a lot of times the client is not there, and they just they make that drive and spend all that time for not even being able to see the person. So being able to connect remotely to do these assessments for eligibility is very helpful. Also follow-up care, right? That's where treatment works, is follow-up. The longer someone's in treatment for substance abuse, the more probable it is that they're going to stay in recovery. All right, so the follow-up makes it easier. Peer support specialists are using it. It decreases readmission rates, very important. Collaborating with collaterals, family members, support systems, and so forth through telehealth. All right. Now, how do you this is the question I get a lot, is how do you promote teletherapy? Like, yeah, Ray, this sounds good. I don't have to travel in the snow. I could work from my home office, and I could work, from other locations. So, like, it sounds great to me, Ray. I could understand, but how do I actually market it? There's many, many, many ways to market telemental health. And just like you market your own practice if you're in private practice, a lot of practices actually thrive with just a couple or few good feeders, referral sources. And how do you develop those referral sources? Well, I could tell you what, a lot of these practice management programs have awesome templates for your progress notes, for your assessments, for a biopsychosocial assessment. And being able to securely give access or deliver those really well-written, good-looking assessments and treatment plans and so forth to a referring provider could go a long way. So technology greatly helps making the connection with other clinicians and making referrals securely, and also doing it in a way that looks really good and gives all the accurate information. There's actually just recently developed some fantastic platforms where providers could connect with one another. It's similar to health exchange programs. So another way to do it is to provide a webinar, such as we are right now. We're providing a webinar with good content. So if you get trained and certified as a telemental health provider, provide a webinar, letting the other clinicians in your state know about your competence and about telehealth and how it's safe and how you have an emergency management plan for every session, how you verify identity, how you secure the communication, all of those things. When they have clients that are prospective clients that call them and say, it sounds like a fit, but I just can't travel, or it doesn't work with my work schedule, or whatever it is their excuse is, they'll have you on their list of referrals. Hey, what about doing it from home, right? So that's one way, one of many, many ways to promote a telehealth practice. And in terms of the technology is rapidly expanding, and people are inventing really cool apps and platforms and for video conferencing, chat, secure messaging, for tracking mood, for tracking behavior, There's cognitive behavioral apps, there's meditation apps, there's breathing apps, there's, you know, apps for pretty much anything now, right? And they're very, very helpful. So since it's so helpful for our client, we ought to really investigate this, right? And but the investigation is really important. You want to choose the right technology. Some things you want to look for in terms of technology is security, right? You want to make sure that it's actually secure, that the company is doing their part to truly secure the patient data. And then you want to do a risk analysis, because the company might be securing the information on their end, on their servers, but after it leaves their hands, right, leaves their servers, and now you have access to it, and now your client may have access to it, then is it secure? So with any technology that you use, it's really important to, sorry, I have to hide my camera just to help the bandwidth. It's really important to check out the security. You have, like Scott mentioned, you have to have a business associate agreement, which legally says that technology provider is liable to follow all HIPAA's rules and regulations, and to really test out the platform. So as Scott mentioned, you know, you want it to be very easy to use. Your clients are already stressed out, they're already overwhelmed. You want the technology to be even more overwhelming to them, right? So some of these video conferencing platforms, you actually have to download the program onto your own device before you can use it. Sometimes that download process is easy, sometimes it's not, right? Some of them are cloud-based, like Scott and Miguel's platform, VP Therapy 360, is cloud-based, so the client doesn't have to download anything. In terms of security, sometimes the program actually operates on a shared server where there's many different video conferencing sessions happening within that same server. Like VP Therapy 360 has dedicated servers for each provider, which really helps with that security and also helps with the performance of the video quality. Video quality is very, very important. I don't know if you think about a time where you're driving down the road, hopefully using a handless, right, using a headset, talking to a family member or friend, and you have all this static and it's hard to hear them, and they're telling you something really important, and you know they're getting tired of you interrupting them, asking them to repeat themselves, but then after they're done sharing what they're sharing, they expect that you understood what they heard. There's nothing more frustrating than that. So I recommend that you really vet out these platforms and find one that's a fit for you and fit for your clients. And by the way, you'll find that there's no one-size-fits-all. Some platforms are going to be good for some clients, some are going to be good for others, and same with your practice. In terms of training and competence, it's, you know, in every code of ethics, it states that we're only supposed to practice within the boundaries of our competence. Within the boundaries of our competence. But technology is so mainstream, it's part of our daily life, right? We're always using technology, like every day. So a lot of times clinicians don't think about whether or not they're actually competent in using email with clients, or texting with clients, or video conferencing, or any of that stuff with clients, electronic health records. So it's really important and the thing with competence is you don't know that you're incompetent until you learn about these things. And I don't mean to be harsh or anything like that. It's just like any other thing. When you start to learn about all of the security issues with using technology and best practices, then you start to say, wow, you know, I didn't know those things, and now I do know what to do, and I could actually practice within competence. So I think that's very helpful. the National Board of Certified Counselors, NBCC, they were the first ones to come out with best practices for distance counseling. Over 20 years ago, they came out with a document that you could see online for best practices for distance counseling. And then about 10 years ago or more, they developed a credential for distance counseling, which required like 15 hours of training, passing a credentialing exam. You have to be licensed or be an NCC, and then you get credentialed, which allowed the community to know like who's actually competent in providing telemental health, right? So I'm the provider for that training for the DCC. That's one of the trainings we offer, and we also offer shorter trainings like the Essentials and Ethics course. But whatever, wherever you take training, isn't the issue. It's get trained and get trained well for providing telemental health. So thank you very much. If you have any questions, please reach out to us. I love hearing from people. And all yours, Dan.
All right. Well, thank you. That was very helpful. I did have a couple questions. If anybody could maybe out there on our panel could help with answering some of this. We're wondering, in Illinois, there are no separate licensure rules relating to telemental health. So whatever the rules and laws are for regular counseling, that's the same for telemental health. Are there some states that are regulating this as a separate entity?
I could speak to that. Yeah, there are many states that have rules and regulations around telehealth. However, I recommend that people get involved with the American Telemedicine Association. This is a nationwide association of practitioners from all fields of healthcare that practice and research and are very knowledgeable about telehealth. They do a lot of advocacy, provide a lot of resources, and the goal is that telehealth is treated just like any other healthcare, that there's not special rules and regulations for it. It's simply providing healthcare, that there's not unnecessary restrictions or undue say restrictions on telehealth that there aren't for just regular same location healthcare. So the fact is, no matter what modality we use as a clinician, we ought to assess for fit, we ought to look at the risks and benefits, we ought to do all those things that are within our codes of ethics, no matter what modality is used.
Okay. I hear some companies out there, and I get flyers all the time about text therapy, and I see even ads on TV of, sign up for this service and you can do text therapy counseling back, and that's all it is. There's nothing else involved other than the texting. Any comments on that?
Yes, I have comments on that. So you have, I give clinicians great caution on ever signing up as a provider for any of those companies. So again, it's hard to know what to look for until you're trained, okay? So when you're trained, you learn how to look for compliance with HIPAA, legal, state law. So a lot of these platforms are having clinicians practice over state lines, which is simply illegal. They don't provide a business associate agreement, which is a HIPAA violation. They're not actually allowing for assessment for fit before you actually have a session, which is not ethically compliant, or verifying identity, or having an adequate emergency management plan for every session. So there's many competencies that go along with telemental health, and we do have to be very careful when considering working for any of these any of these online companies. There are some good ones. And even the good ones, you have to do an analysis of how is it that you ought to use those platforms in a compliant way.
Have you seen anybody who gets, I know with regular profession, people sometimes get paired up with a psychiatrist where they'll work hand in hand. The psychiatrist does some portion of it, sometimes the medication, and then the counselors do other portions of it. Any situations where they're doing that? Because I know more and more psychiatrists now are doing telepsychiatry.
Yes. Let me give you another good resource. So the federal government is in full support of telehealth. When I say full support, they're in great support. Let me say that, okay? They're in great support of telehealth. They've given tons and tons of grants, and they financially support telehealth resource centers throughout our nation. So in every part of our country, we have a telehealth resource center. You could find those. I have a list of them on my website under resources. So what I would do is, if you're a telemental health provider, I would contact your local telehealth resource center and ask them what psychiatrists in your area are providing telepsychiatry. I actually did that recently to get some more referrals, because I have a client who's needing a psychiatrist, and I was having trouble really securing an appointment for him. So collaborating with psychiatrists is very, very helpful when it's done remotely. Another thing is organizations such as Teladoc, MD Live, that's what they do. They have healthcare providers of different fields that all use the same platform, so they're able to easily share records and collaborate on care in that way.
And your website is telementalhealthtraining.com?
Correct, yep, telementalhealthtraining.com, yep.
I should mention for our listeners, you talked some about clinical supervision through telecommunication. Currently in Illinois, the law does not allow for supervision to occur that way, but there is a process going on now with some rule changes, and I know one of the changes that will probably occur is some allowances for telesupervision, whereas right now it all has to be in person. That I think the future is going to hold some opportunities for this to occur through other means of communication.
Mm-hmm.
This is Scott, and I will agree with that. We're seeing a lot more states and licensure boards in terms of supervision being more open to video communication. Again, we talked earlier about the goods and the bads of video communication freeware like Skype and the like, and a lot of supervision was being done via those means. And as much as Ray said earlier, as much as you want to walk the line and think you're being careful, you just can't be all the time. And that's what I think some of the states have been very slow to move for supervision to be anything but face-to-face. But we're definitely seeing trends in our region and other states throughout the United States that are opening up. So I do hope that Illinois changes their rules a little bit, and at least, like we have in North Carolina, be able to do 2 or 4 sessions per month via non-face-to-face, via video communication.
That sounds like a good system.
Yeah, and I think making these decisions as a state ought to be based upon research. And there is a lot of research done on telehealth and telesupervision. And I think kind of basing those decisions upon the research would be very helpful. And also really valuing that clinical decision making as to what the needs are of the situation of the client or supervisee is a big part of it.
So if one of our people watching this wants more training so that they become, maybe not an expert, but that they become good at providing this, where will they go?
On my website, telementalhealthtraining.com, there's a training tab in the menu, and there's online training, and I have a telesupervision course and also a telemental health course. Yeah, if you could put that on the screen, that'd be great. So either one of those, for the telesupervision course, of course, is for clinical supervision. It's not just about clinical supervision, actually. No, telementalhealthtraining.com. Telementalhealthtraining.com. So a lot of clinical supervisors are supervising clinicians who are using technology in practice. And it teaches how do you actually assess your supervisee's competence in using technology. because it's part of the supervisor's job to define the boundaries of competence and the boundaries of the supervisory relationship. So it covers all of that. So telehealth is not just about providing services from a distance. It's also about using technology, period, right? In practice. If you scroll down that page, Dan, if you just scroll down the page, you'll see the telesupervision course there, and then the you scroll up a little bit, those boxes. There you go. Yeah, the telesupervision online course, the telemental health counseling essentials and ethics course. Those are the courses I'm referring to. And then the DCC course is the course if you want to get credentialed as a distance counselor, which I think is a very helpful certification at this time.
Well, that sounds like a great resource. Anything else any of you'd care to add?
Yeah, obviously I want to thank you for your opportunity here, but we're all kind of here to try to move this modality forward, and I think Ray's done a tremendous job, and the certification is certainly a big part of that. From our company standpoint, we like to be very consultative in our sales, so we offer an onboarding option to our subscribers, whether they're for our individual clinician subscriber, which is called Beat 360, or our VP Therapy Pro package. In either case, you can opt in to do the onboarding, and the onboarding actually has the intention of giving you the tools and resources it's going to take to become successful in your teletherapy practice. And part of that is actually one of Ray's handbooks, which is included, this the billing side of things, forms for informed consent, forms to kind of get your contracts amended depending on how you work with state and MCOs and that sort of thing, and any other type of information we can help you with in order to get your practice off the ground. And obviously training and such is included with anything, but we really want to try to make this as successful for everyone as possible. And you're bringing our site up right now, which should look a little different here in the next couple of weeks. But for more information or to contact us, please feel free to go online and schedule a demo or anything you'd like. So, thank you, Dan.
All right. All right then. Anybody else have anything? Otherwise, we'll draw to a close and thank everybody for participating in this webinar. If you wish to hear more about this or the Illinois Mental Health Counselor Association, please go to our website, imhca.org, and you can email us at myimca@gmail.com. We'd be glad to share this with our members and hope that you find it helpful. Thank you to our presenters, Scott, Miguel, and Raymond. We appreciate you taking the time today to do this.
Thank you, Dan. Thank you, Ray. Thanks, Miguel.